Hello everyone, so today we will learn about the measles. Measles virus belongs to the family paramyxovirus and the mode of infections is generally via droplets and the period of infectivity is 4 days before rash to 5 days after the onset of rash. The two important proteins involved in the induction of immunity of the measles virus are the hemagglutinin protein and the fusion protein, and our body produces antibodies against these two proteins to neutralize the virus and limit the proliferation of virus respectively. Measles virus pathology includes infection of the respiratory and the non-respiratory tissues, and the hallmark of infection is generally the multinucleated giant cells which are known as the Warthin-Finkeldy cells. Please make a note of this. This is as an important MCQ point. And Warthin-Finkeldy cells, this is the image-based question that can be asked. As you can see, this is multinucleated giant cell. Coming to the type of receptors, CD150 receptor and the PVRL4 receptor. These two receptors are important to remember. They are present on the lymphocytes, alveolar tissue and CNS and the respiratory tissue respectively. PVRL4 is also known as Nectin-4 receptor. Modified measles is measles in someone who already has pre-existing immunity either due to passive immunization or active immunization. And the WHO strategy against measles is to catch up, keep up and follow up with the cases of measles. Clinical features includes fever and prodromal symptoms. The 3 C's that you have to remember is the cough, the coryza and the conjunctivitis. In these 3 C's, the most consistent feature is conjunctivitis. Conjunctivitis is generally present in almost all the children who are affected with the measles virus. As you can see in the picture here, the child is also having conjunctivitis. You can find conjunctivitis in the children affected with measles. Day 2 or day 3, you can see enanthems, which are nothing but Koplik spots. Koplik spots can be found in the oral cavity and they're usually grainy white spots generally present in the oral cavity near the lower molars, and lower second molar is the most common site, but it can also be seen in the other areas in the buccal cavity. On the day 4 of infection, you can see the rash, which is erythematous maculopapular rash, starting on the face and behind the ear, then spreads to the trunk and the limbs. This rash disappears in 1 week and leaves post-rash hyperpigmentation, which is known as brownish pigmentation, also called as brownish pigmentation. Coming to the complications, the most common is acute otitis media and the severe and the rare one is the subacute sclerosing pan-encephalitis. And the most common cause of death in measles is pneumonia. Primary pneumonia is also known as the H. pneumonia or the giant cell pneumonia, and the secondary pneumonia are due to the bacterial infections. The black measles or hemorrhagic measles is an entity where you can see erythematous hemorrhagic bullae on the skin, which is generally red to black in color. And coming to the other complications are myocarditis and diarrhea. Diagnosis and treatment. Investigations include finding serum IgM antibodies against the virus and 4-fold rise in the IgG antibody titers after 2 to 4 weeks of infection. And virus isolation and PCR are also the other investigation techniques. Treatment is usually supportive and vitamin A is given once daily for 2 days. And ribavirin is a drug which is being researched on against measles, that is not FDA approved, so it is generally not used in these children. Vitamin A doses have been mentioned according to the age. Prevention is via the measles specific vaccine, and the post-exposure prophylaxis is with the MR vaccine and the measles specific immunoglobulin, which is given within 6 to 7 days after exposure to the virus. Thanks for watching. If you like this video, please like, share and subscribe and follow for more.